Hi, hello, hello. Thank you for watching. Hi, this is Nurse Choma. Hello, come on in, come on in, come on in. Hopefully you can see me okay and everything is working okay. Let me double check. Don't be shy, say hi in the chat box. Let's see. Okay. Okay, all right. All right, if you can hear me, put one or say yes in the comments. All right, and then you can look for the chat box. The chat is at the bottom. You can see it right there on the bottom of the screen. Okay, okay, welcome, 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 welcome. Let me know where you're tuning in from. Excuse me, where you're watching this webinar from. Let me know in the comments. If let me know if this is your first time watching one of my webinars. I hope that you are excited to be here. I am. I'm glad that you're here. I'm glad that you decided to tune in, and I hope that this will be beneficial to you. Hi from Florida. Welcome. Hello, hello. Thanks for joining. Good, good evening or good afternoon. I know we have people in different countries. Or good morning. So welcome from Florida, though. Hello. Thank you for being here. So let me go ahead and I'm going to pull up the presentation about how to pass your LPN exam. So hopefully you'll be able to see it okay. I'm going to pull this up and so right here, I'm going to click the share button. All right, come. Okay, there we go. Awesome. Okay, so hopefully you should see this on the screen. And so what I'm going to do periodically is I will go back and forth between the chat and the presentation so that way I don't miss what you're saying in the chat box. And then hopefully you can hear me okay as far as the sound. And you definitely want to listen to this all the way from the beginning to the end because I may not send out a replay. So I would encourage you to watch this. I won't be able to go back and forth with the slides. So I'll take my time, but I also know that your time is valuable and people have things to do. So just pay attention closely and then watch this all the way to the end because there may not be a replay. All right, so let me go ahead and make the screen nice and big for you to see. And we're going to go into it. So welcome to how to pass your NCLEX-PN exam. So how you're going to get the most of this training, I want you to shut down all distractions right now. So social media, TV, whatever you got in front of you, go ahead and put all that set aside. Of course, get a notebook, paper, pen, pencil, take some good old notes and participate, right? Be a part of it. Ask questions. Now, I will say that I do have a lot of slides. So let me say like a lot like that. But I do have some slides I want to go through. So I'll definitely probably answer the majority of the questions towards the end. And I'll try and keep this about an hour long, okay? So let me ask you a quick question. What would it mean for you if you did in fact pass your NCLEX exam, right? What would that mean for you? What would that do? And I should say not if, but really when for you, right? So maybe it's a new house, right? Maybe for you, maybe you and your family, you're tired of renting, and so you want to be able to purchase your own home or your first home. Obviously, it means a new job, right? So being able to have a better job, better pay, hopefully, better benefits. So that would be awesome. And then the third thing too is just having a more confidence, right? A greater sense of security, because at the end of the day, when it comes to, getting a nursing job, especially with the pandemic, now more than ever, nursing. I always say that nursing will always be in demand, right? But the pandemic has made us in demand more than ever. I recently saw a post where they're paying some nurses as much as $275 per hour, which is crazy, right? So it can be really a position where you'll never have to worry about getting a job. That's never going to be a problem for you. But other people who went through different trainings, different majors, that's not guaranteed. They may not have that flexibility or that luxury. And then maybe for you also, it's just you wanted to, make a difference, right? So I know for me, that was part of my joy too. I wanted the independence, but I also wanted to have a big impact and, be with people during during their most vulnerable periods of their life. So that's another thing that's beautiful about being, a nurse, is that you get to spend real quality time with the patients, and you get to have a bigger impact. So let me know in the chat box which one describes you, all right? So the first one is you recently graduated from nursing school and you want to be sure you pass your NCLEX-PN exam the first time. 2, you recently failed your NCLEX-PN exam and now you're not sure what you should do next. 3, you've taken the NCLEX-PN exam multiple times despite using multiple resources. And then 4, you graduated from LPN school 1 or more years ago and you're trying to pass your test now. So are you 1, 2, 3, or 4? So let me take a look to see in the comments where you're going to put 1, 2, 3, or 4. All right, so maybe, let's see. I know we often get some 2s. So 4, great, awesome, okay. 1, okay, cool. All right, good, good, good. Right, so as we get people also that it's like a mixture. We get 1, 2, a lot of 2s. 1, okay, good. Thank you for sharing. All right, awesome, okay. All right. So now I want to go over what you're going to discover from being a part of this, from watching this, from taking time from your day to watch this presentation I put together for you. We're going to go over the best blueprint to passing the NCLEX-PN test the first try or the last time if you're taking it again. And we're also going to go over a good overview of the content areas that's covered on the test. And then we'll talk about the biggest mistake that a lot of NCLEX-PN test takers don't even realize that they're making. That's making it difficult for them to pass. And then I'll also go over with you one of my secret strategies to answering difficult NCLEX questions. So really briefly about myself, I graduated nursing school May 2010. I did go through a Bachelor's of Science in Nursing program to become a registered nurse. So I've been a nurse now since 2010 of May. I've done med-surg telemetry nursing, insurance nursing, worked with lots of LPNs, and definitely more than qualified to help PNs to pass. Now we've been doing this, helping nurses to pass the test since June 2015. And we've had so much success, especially with repeat test takers, including LPNs and RNs to pass their exam. All right, so that's just a little bit about myself in case you have never heard of me or met me before. So let me ask you a question. What do you think is the biggest challenge when it comes to passing your NCLEX-PN exam? What is that? What do you think that is? What's the biggest problem, right? And I'm sure I probably know what you may say, but I would love to hear what you think. All right, let me know in the comments. What do you think is the biggest challenge? Okay. All right. So here's some of the common things that people usually tell me. One, it's learning the content, so learning all the content can kind of feel overwhelming, a lot of information to cover, right? So that's one. Two, not understanding how to even think critically, right? So, and that helps you to answer questions. And then three, just really overthinking the questions, right? Thinking too much, double second guessing yourself, all of that. So here's my solution. And you always want to have a plan, right? And so what I try to do is I try to give you a systematic approach to studying. So here I outlined it for you, and jot this down. We're going to go over each of them throughout the presentation. But we have client needs, we have disease management, we have mental health, we have treatment, and we have complications. All right. Those are the different elements that you want to review and be aware of when it comes to studying. Everything I'm going to go over with you today it's all of it is from my review course, and so nothing is theoretical. It's all information that I took in from our prep review course that has helped other people to successfully pass their tests. So here's the first mistake: learning the body systems only, right? So how many of you were told, or your priority has been, yeah, I'm going to study cardiac and then respiratory and then endocrine, right? And then maybe you do some questions, right? And so that's what your focus may be or has been. But that's actually that's not really effective. So what you honestly want to do is that for the LPN test, you want to learn the content of the systems, but you want to also include understanding the client needs, right? So it's one thing to study, what is cardiac, what is respiratory, etc. But you have to tie that into the role of the LPN by recognizing what the needs are of the client or the patient. So here's a really good breakdown of it here with the 11 body systems. I put on the far left all of them, their names, and then the other name for some of them. So you should know both, because there's times where you could take the test, and honestly, they could test you on either or. So these are the names, 11 body systems. Then over here on the right is you got to know the normal. The first step, you need to know the normal physiological processes in each system. 2, you should know the appropriate lab values. 3, you should know the organs involved. 4, you need to know common disease processes that affects that system. And then 5, you should know the client needs in that order, right? So for each of the systems. So you should be able to identify what's the processes, the labs, the organs, then the disease, and then what the client would likely need. We'll do some examples. So here's an example with the cardiovascular system. This system, it circulates blood around the body via the heart, arteries, veins, right? It delivers oxygen and nutrients to organs and cells and carries their waste product away. The organs involved is the heart, right, which is a hollow muscular organ, and that pumps the movement of blood to the body. We have the right side and the left side. So the right side is where deoxygenated blood enters, and the left side is where oxygenated blood enters. The arteries include the coronary arteries, and the veins are all part of this system, right? That's number 2, the organs. Here are some of the labs that's involved as well. So we have hemoglobin, men and women. It's a little bit different, but almost the same. You should know the hematocrit, the white blood cells, and then these last ones down here is part of the cardiac system, but it's also part of the lymphatic system or the immune system. So the neutrophils, bands, lymphocytes, monocytes, and eosinophils. So here's the thing. For the exam, you should prioritize memorizing the normal values, but then also, what would happen, what would cause them to, drop, and what's the typical treatment, right? That's the biggest thing about the labs, is that it's not just knowing the ranges, it's also being able to recognize when they lower or they're higher, and then what we do. All right, so now the second to last step, right? The normal processes, the blood flow of the heart, right? So now the you need to know, and you should have it already memorized, how does blood flow through the heart, right? Where does blood enter into the heart? So that's blood flow. Then we have systemic pressure, right? Systemic pressure involves preload and afterload, right? The filling of the heart versus the resistance that the heart has to work against. That's the systemic pressure. And then pulmonary circulation. So how does blood get to the lungs? How does it flow through the lungs? All that is part of the blood flow as well. But specifically the pulmonary circulation is where it is perfused in the lungs. So when you understand the normal processes, what this will do is it will help you to understand the implications of the disease and the signs and symptoms that you can anticipate. Because what you want is that you want everything to flow. You want it to be where you're able to connect the dots, not where you're just trying to memorize everything. The problem for a lot of people is that you're just trying to memorize, but you're not really trying to understand. So when you look at how everything connects, then you can anticipate what would actually happen next. And then that makes it easier for you to answer the questions. So here are the 5 P's for client needs. So you want to write this down or take a screenshot. Patient rights, right? So this is a core. Not only could you get a question about what are the client needs or the 5 P's, but also you use this as kind of like a blueprint or another template to identifying their needs. So what's their rights? What are their legal rights, right? Patients, they do have the right to refuse. That's example of one thing, right? So what are their rights? What are the priorities based on their diagnosis, right? So like ABCs. What do we prioritize more because they have heart failure versus if they have COPD? Patient management. How do we collaborate with the team to administer care? And what kind of tasks do we need to administer to help the patient recover? Right? So between you, the LPN, to the RN, how do you coordinate with the RN? How do you coordinate with the doctor to administer care? Patient safety. What are the potential hazards and complications that the patient is at risk for based on their diagnosis and medical history? Right? So being aware of, okay, what could go wrong? What could they be at risk for? Right? That's really important. Patient transitions. What are the developmental and aging transitions of the patient and how is it altered because of their diagnosis and medical history, right? So for example, what do we expect from the time that they are transitioning from adulthood into geriatric or more elderly? What do we expect when they are transitioning from infancy to toddler? Those are the things I mean. What are the developmental and aging transitions? Another tip is that you should use visual aids, right? So this is a great picture showing you what we just talked about as far as blood flow, right? And it's literally describing to you all the steps in this photo. So essentially blood, it does enter deoxygenated on the right side, right? Through the superior vena cava or the inferior vena cava. It goes to the right atrium, it goes to the tricuspid valve, it goes to the right ventricle, then there's an aortic valve, and then there's the pulmonic valve, then the pulmonic artery, and then this connects to the lungs. It gets perfused in the lungs, comes back to the pulmonic vein, comes to the left atrium, left mitral valve, left ventricle, aortic valve, aorta, and then the rest of the body. So seeing photos like this, it can make a world of a difference with your ability to retain the content quickly, right? Immediately. Because you don't want to take a long time. You don't want to take forever, right? But one way you can do that is through visual aids. So looking at client needs, let's talk about psychosocial integrity. So, and this is all, I took a lot of this information too, or some of this information as far as the core specific concepts, also from the NCLEX-PN with the LPN test plan, right? So their test plan also goes over some, but not everything that is covered on the LPN test, right? So everything, so I'm not going to list out all of them, but these are some of the core topics with psychosocial integrity, right? Abuse or neglect, all the way to therapeutic communication. So you should be familiar with each of these topics and what they mean. Physiological integrity. So this assesses the nurse's ability to provide proper nursing care in a manner that's conducive to either maintaining or helping to achieve and maintaining balance and wellness. So this is basic care and comfort, pharmacology, reduction of risk potential, and physiological adaptation. So maybe you took the test and you didn't pass your exam and they gave you your results, bam. These are some of the areas, if you did not do well, these are some of the areas, right? So physiological integrity includes those 4 categories. Health promotion and maintenance. The practical vocational nurse provides nursing care for clients that incorporate the knowledge of expected stages of growth and development and prevention and or early detection of health problems. The related content includes aging, right? So once again, you should know the aging process from infancy to geriatric. Health promotion or disease prevention. How do we prevent the disease from worsening or occurring? What is antepartum? What is interpartum? And what is the postpartum phase of maternity health? And what is the normal newborn care? What are high-risk behaviors? And then also the development or Erickson's stages of development and transitions, right? So you should be jotting all this down if you don't know it already as far as topics you should study that will be on the test. Safe and effective care management, right? So this focuses on measures to promote safety and coordinate care and knowing safety infection control measures. So coordinated care, the practical or the vocational nurse collaborates with healthcare team members to facilitate effective client care. Safety infection control, the practical or vocational nurse contributes to the protection of clients and healthcare personnel, from health and environmental hazards. Right? These are all the things you think about. These are also your standard precautions. This is like surgical or aseptic technique. That's all infection control, right? Disease management. How do you, as the LPN nurse, manage the disease? Now, I want to really mention something so important right here. How many of you are CNAs, right? Maybe you've been a CNA for a long time, or you're a medical assistant, or you're a phlebotomist, or you're a pharmacy tech, right? But probably the most common one is usually CNAs. And you're trying to take the LPN test, right? Here's the thing I want to really hit home. It's hard for one of the reasons why people may struggle with passing the LPN test, especially if you have worked in one of those fields for a long time, is that you don't realize it, but you're looking at the content from the perspective of your work experience. And the problem with that is that your work experience is the role of a CNA. Your work experience is the role of a pharmacy tech. So sometimes what happens is that people will often not realize it, that because you maybe find yourself, when you look at a question, you'll reference something that you saw at work. Or you'll say, oh yes, my friend or my mother or someone or an aunt had this problem or stroke or this disease. And you're not aware, because there's a limitation. There's a limitation where you may know something, but it doesn't mean that you know the full picture. And so that's the part, is that you need to focus on, okay, all right, I understand this from the CNA role, but how does it differ as an LPN? What are the intimate tasks or focuses that I should have as an LPN? When you begin to ask yourself the right questions, you'll begin to notice that you do better with the questions. And you begin to notice that you do better with the content. So the problem is that you're not learning all the right details, right? You're studying, you're going to the library, you're reading the books, you're getting different reviews, etc. But the issue, though, is that you're not aware of all of the pertinent details, because there's so much information to cover, right? Because you feel like you're all over the place. But if you're not aware of the specific things, then you're always going to find yourself missing it on the test. So here's what I mean. This is what you have to know. For every disease process, 1, pathophysiology. You got to know that, right? Patho is understanding how does that disease change the way the body is supposed to work. Signs and symptoms, got to know that too. What are the appropriate signs and symptoms of that disease? Risk factors. What would cause the patient to have X, Y, and Z? What are the risk factors that's involved? Treatment. What do we do? Here's the thing. For the test, yes, you should know the overall treatment. So important. But do remember that the NCLEX is testing you on what you do. So the problem for a lot of people is that you may get so caught up, oh yeah, they need to have this test done and they need to do this over here. But then wait, what does the LPN do though? because that's what the exam is testing. The exam is testing to see that you understand what the LPN needs to do, not necessarily what needs to be done. It's two different things. So here's an example with heart failure. Patho of heart failure. The heart is unable to pump sufficient blood to maintain blood flow. Bam, right? To meet the body's needs. 2, signs and symptoms. This includes shortness of breath, fatigue, and edema of the lower extremities. Bam. Next one, risk factors. Having an MI, having heart disease, coronary artery disease, and high blood pressure. That's 3. 4, treatment. We give them diuretics. We give them oxygen. We give them beta blockers, but you should know the specific names of the beta blockers, their mechanism, and the side effects. And then we give them antihypertensive drugs as well. This is an example of how you learn and what to cover of the right details. And 9 times out of 10, what people are missing is the patho. The reason why many repeat test takers still don't pass their exam, and I got people that told me that they graduated in 2007, still can't pass the exam this year in 2022, right? Or wherever you listen to this, they still can't pass the test now because they ignore the pathophysiology. So important. And sometimes it's not about ignoring too. So that's essentially, it's honestly, you just don't know, right? You just don't know, and you were not exposed to that in your education. So I'm going to provide for you in the chat box a list of disease processes that you need to know. All right. Yep, that's true. Okay, I'm just saying your comments now. Every answer could be right. I know. I know that's what you're told too, right? But that's not necessarily true though. It really depends on the context of the question. So I'm going to post this in the question in the chat here. All right, and go ahead and download that. Right, list of disease processes. Download that right away, because what you need to do is what I just showed you right now. You need to literally go through that list and knock out each of those 4 elements per disease, right? So starting with diabetes mellitus, the patho, the signs and symptoms, the risk factors, and the treatment, and just keep doing that for all of them. All right, so download that list, review it, study it, know it. And the ABCs is good, right? But the problem that you have to realize is that the ABCs doesn't cover everything. That's just the reality. The ABCs does not cover every type of question, right? So there's more to it than just ABCs. Are you finding this helpful so far? Learning something? Let me know in the comments if you are, or in the chat. All right, mental health. So a myth that you may think, or that some people may think, is that mental health is, it's very minor. It's not really on the test. Here's the thing, that's not true. Mental health is so integral to the recovery and status of the patient. It's so important, right? It really, because it influences the outcome of the patient. So, and then you have to think about the mental health, because if your patient is not participating in care, they're not going to, they're not going to, because they're sad and depressed, they're not going to take their meds. They're not going to eat all their meals, right? And that affects their outcome. So one thing one strategy that's so important is to look for differentiations between different concepts, right? So you want to look at, okay, how is this different from this? A lot of times, like for example, okay, what people do wrong is that you study what something is, but you don't study how it's separate. So for example, I could be studying hypokalemia and hyperkalemia. And you could study, okay, hypokalemia is low potassium, hyperkalemia is high potassium. They have this, this, and this. Now ask yourself, okay, how are they different? Because that's gonna mean a lot. You having clarity on the difference when you get a SATA question, when you get a priority question, when it says, okay, which of the following are the signs and symptoms of hyperkalemia? Select all that apply. Now it's like, wait, is that hypo or hyper? Right? You're going through the choices and you're like, wait, is that one hypo or hyper? Because you did not stop to look at the differences. Right? So that's really important. That's how you think more critically. Here's an example. Abuse, right? Common topic that you'll see on the test. Physical abuse could include punching, burning, twisting. Psychological abuse, threatening to harm, locking them in a room, bullying them. Sexual abuse, sexual contact that's not agreed. Financial abuse, withholding funds that belongs to them or abusing their power of attorney for one's own personal gain. That's abuse. But here's neglect. Physical neglect would look like not providing physical care, right? When the abuser can. Psychological neglect, isolating the victim from others or in their own home, away from other members of the family. Financial neglect, not providing the victim with basic essential needs. So you see how if you was to only read abuse and then read neglect, you could easily confuse the two. But if you stop and ask yourself, wait a second, what makes these two different? Because the way you'll see it on the test is that it will give you a scenario and it may ask you which does this describe? Battery, abuse, neglect, or assault. So abuse is more intentional, right? From what we look at here, abuse is something where they're intentionally doing something to the victim. But neglect, it sounds like it's more so they're withholding something, right? So literally abusing is like they're intentionally doing something, but neglect is doing something that's within their power, but they're not doing it though. They're withholding. So pay attention to differentiations. It will help you a lot when it comes to critical thinking and SATA questions, and it will help you to stop second guessing everything. Here's an important tip. Identify how the mental health status of the patient influences the outcome. How does them having schizophrenia affect their overall health? Not just their mental health, but the overall health. Here's an example, right? Let's say if you have a patient that has frequent psychotic episodes, what will that mean? Well, we're going to obviously have to do something to stop the episodes. So we may give them a drug that's commonly given called Haldol. But the problem though is that Haldol, the side effect, hint, is that it can change the rhythm of the heart, which would affect the outcome if they begin to develop dysrhythmias. And that can lead to a longer hospital stay. So nursing is all about seeing how everything connects, not separating everything. Right? So a lot of times the reason why people are doing poorly is that you're separating, okay, let me learn the drugs over here. Let me learn psych over here. Let me learn heart over here. Versus how does it all flow together? How does this affect this? That's looking at the bigger picture. And that helps you to think more critically too. Oh, here's a testimonial. This is one of our favorite testimonials. Soledad. So she was struggling to pass her LPN exam, and she's been an avid follower on our social media page. And so she actually decided to invest in one of our programs, which is our LPN 2.0 program. And one thing she said right here, she said, "I'm so grateful. It gave me the courage and the self-confidence to go into taking my NCLEX test. I bought the program based off your Facebook post, but buying the program, I gained so much. I gained much more. I gained a support system. I'm so grateful. I can't stop saying the good things about you. The tools in the video alone, the worksheets, and the guides. I was able to listen to the audios with my everyday life. And to be honest, I couldn't commit to just sitting down and listen to you, but you made it happen." Right? So this is a really wonderful testimony of somebody who she was discouraged when she came to us, but she kept on going. And she took advantage of one of our resources, our LPN program, and she got the momentum back. So that's what you just need. You need to just get the momentum to do it all over again. And everybody is different as far as like what motivates them to start studying again. But I hope that this can be, the tipping point to helping you, to pushing you to get to that place. All right, treatment, medications. Here's a mistake that people make with pharmacology: not recognizing the side effects. Okay? Not recognizing side effects, adverse effects, and the potential interventions. So side effect is something that we would expect to happen, but it doesn't mean that we stop giving the drug. Adverse effect is deadly. So you have to stop the drug right away and tell the doctor. See that? So there's a difference in the intervention for side effects versus adverse effects. You got to know that for the test. Okay? Super important. Especially with drugs you see all the time. So let me post this question. A fairly simple question. Which of the following adverse effects is associated with levothyroxine synthroid therapy? A, B, C, or D? All right, I see a B. Probably you guys are still thinking about it. Okay. All right, maybe you guys are kind of stumped a little bit. But let's go over it then. So Synthroid is what? It's a thyroid medication, right? So the problem is that with Synthroid, we're trying to increase their thyroid levels. Actually, so if it's too much, it can result in tachycardia. All right. So and if it's in that, and this is, I'll probably say, because tachycardia, depending on how tacky it is, would be an adverse effect, right? So, but there's some people where their heart rate may go up a little bit, but it doesn't necessarily mean that it's 130s, 140s, right? But if it goes up at that rate, then yeah, that's an adverse effect. So levothyroxine, especially in higher doses, can induce hyperthyroid-like symptoms, including tachycardia. An agent that increases the basal metabolic rate would not be expected to induce a slow heart rate. Hypotension will be a side effect of bradycardia, and the constipation is a symptom of hypothyroid disease. Okay, so it's A, the first one. So here's a recommendation of how to group the drugs. I have on here on the left a good template for you. You could create like a upside down pyramid or something like the way I have here, where first you have the classification, then you have the drug name or the prefix, the rationale, the route, and the side effects. So here's an example over here: fluoroquinolones. Then we have the drug name, levofloxacin, but the prefix is floxacin. The rationale is that it helps with, it's an antibiotic, specifically antimicrobial antibiotic. It works either as an IV piggyback or oral. And then you can't see at the bottom, but it can cause upset stomach, GI upset, or central nervous side effects, central nervous system side effects, right, involving the brain. Okay, so this is like a great simplified method to helping you to organize drugs, right? Helping you to organize the drugs and learn a lot of medications, right? So this will help you to learn the drugs faster by grouping them. So what people do wrong is that they'll spend time doing like one drug at a time and take forever, But if you do this, you'll learn a lot more drugs because you group them faster, clearer, easier, simplified. Here's another testimonial of Sandra. She says, hi, my name is Sandra R. I don't know where to start, but to make a lot clear, when I set my test date, I was not really sure of how to study and what to study. So maybe that's you. Do you feel like you don't know where to start, what to do, if you're doing it right? But Nurse Choma showed me how. She was very explanatory with subject materials for the NCLEX. She taught you how to study, how to relax when studying, because this will help with studying for the actual exam. I want to say her material is very much so worth it, and I would recommend it to anyone trying to pass the NCLEX, and for those wanting to pass the test on the first try, like I did with only 85 questions. Thank you, Nurse Choma. All right, so that's Sandra, who passed at the time of the test with 85 questions. All right, here's the last step, is complications. All right, complications. So here's a common mistake: not matching the complications with the disease process, right? It's a common reason why people struggle to think critically. So the category reduction of risk potential, that's about 12% of the test. So one thing that will help you to think critically is knowing what is the potential complication of the disease. So for example, if somebody has diabetes type 1, the potential complication is DKA, right? DKA, diabetic ketoacidosis. So what you got to do is that you should honestly, using the list I just gave you, go through and identify, okay, each of the potential complications for those diseases. Super important, because it will help you to think more critically. I want to show you an example here. So you got to be complication conscious. So if somebody has heart failure, a potential complication is pulmonary edema. Pulmonary edema is a life-threatening emergency where they have too much fluid in their lungs, and now they can't breathe. So you have to respond right away, otherwise they could die. Right? Versus if they have heart failure is chronic. But pulmonary edema is a complication if the heart failure worsens. So this is how you stop failing the test. or position yourself to pass the test is that you're more aware of the complications, right? Because you have to realize that you knowing the complications, it shows that you're safe, right? It tells the NCLEX this person is safe. We can give them a license. We can trust that once we issue them a license number, they will be able to recognize complications, recognize potential problems, so that way the patient does not have an increased mortality risk, right? So your priority is to, how can I be more complication oriented? How can I think more critically? Here's an example. So I want to show you a test results example. And so we had like a student, somebody actually, she reached out to us. She saw, trainings, etc. And it was like, and she emailed us, and as soon as she emailed us, she gave us a copy of her test results, which like the last NCLEX that she took and she didn't pass. She gave us a copy and asked us to help her. Okay, so I'm going to show you what her results look like. And please don't email us your test results, okay? Don't do that, right? So, but let me show you an example here. So here's what it looked like. Physiological adaptation, above passing. Health promotion and maintenance, above passing. Pharmacology, above passing. Safety prevention control, above passing. Psychosocial integrity, above passing. Management of care or coordinated care, above passing. Basic care and comfort, above passing. But here is reduction of risk potential, below passing. And like I said, guess what? This person, they did not pass their exam. All because of one category. And this is not the only time that others have told me they got the same results. Because read the name of the category. Read what it says. Reduction of risk potential. So that means that you should know how to reduce potential risk. What is potential risk? Complications. So your ability to recognize what your patient would look like if they're getting worse is what this category is all about. Gotta know it. Gotta master it down as well. So here's the key. When it comes to NCLEX, it's testing you based on your own judgment, right? One of the main ways you demonstrate that judgment, it's one of the main ways that you demonstrate nursing judgment is that showing that you're a safe nurse. Safe nurses reduce the risk potential of a patient by identifying those complications early. If the exam does not think that you're safe, it will not pass you, right? So I know a lot of times our focus is, I want the license, which you should, absolutely. But you have to also remember on the other side is patients that are going to be under your care. So it should be where, you know what, I want to be the best nurse possible, right? I want to know that my stuff, especially now with the nursing has changed so much, where honestly you need to be able to hit the ground running. You may not get a job where they orient you, or you're with a nurse for 6 weeks. That would be great if you did, if you precepted with 6 weeks. But the pandemic has changed so much. I can't even begin to tell you how much has changed. And so you want it to be where your focus is not just, yes, getting the license, but it's not just about like memorizing and regurgitating information. It's really where you also want to know this stuff. You want to genuinely know it so that way you can take care of patients well. So another strategy, look for complications, focus on early versus late symptoms. Okay? Early versus late symptoms. Really, really important, because that shows that you recognize that the patient is getting worse before it happens. Right? Hopefully you're doing well so far and that you are just taking this all in. All right? We're almost done. Here's another example here with aortic aneurysm. Excuse me. So this is enlargement of the aorta to greater than 1.5 times the normal size. Patients are asymptomatic until it's ruptured. But if it does rupture, they'll begin to experience a lot of bleeding. And if it's not treated right away, they'll die, right? They'll enter into shock. So you would need to be able to recognize the symptoms that rupture has occurred. All right, so that's an example of being complication focused as well. What we covered so far, right, is that we talked about the blueprint to passing the test on the first try, the biggest mistakes that a lot of test takers don't realize that they're making. Several strategies actually to answering difficult questions like differentiations, complication focused, right? And then we went over all the different content areas that you need to study, review, and know that's on the test. So I want to ask you in the chat, let me know, are you starting? Yes, to see how you can pass your NCLEX-PN exam, right? If you just take the information I've shared with you, and you implement it, you do it, you put in the work. Do you see how it's possible now, right? So possible, regardless of where your history, where you're at, what you've gone through, what you've done, or like how many times you failed, right? Hopefully you're seeing the aha moments. Hopefully this is also kind of giving you or renewing hope if it's been a long time, or if you felt discouraged up until now. Okay, so here's what some things you may need now is, well, how do I now take this information and put it into a plan, right? A step-by-step plan of the specific content to study so you don't feel overwhelmed. Information on the content that's broken down in a way that you understand. How to take what you know about the content, apply it to the NCLEX. And then how to pass the test in either 85 or 75 questions if you have filled it before. I know it varies as far as the number of questions with the pandemic and everything. So how to pass the NCLEX now, like quickly, right? Because you don't want to pass it, you don't want it to be where you're dragging your feet. So the number one rule to passing the NCLEX is being able to apply the content. Because it's one thing to, learn the information, but you have to also know how to apply it too. And this is what I talk so much in depth, in our LPN review course. Because, we've been on here for like maybe about an hour. And there's only so much I can cover, obviously, in an hour. And if you found this teaching tonight beneficial, oh my goodness. It's like I'm reviewing this with you 10 times, 1,000 times more than what we're going over right now. So who this course is for? If you took in your test at least once or more, and you're just at a loss with how to pass it now. If you have recently, or you're preparing to finish LPN school, and you want a simplified, easy method to understand and review that allows you to move at your own pace. And then if you want a full in-depth review of the NCLEX-PN exam, which includes organized content, video teachings, strategies, as well as practice questions, right? So if that sounds like you, then this is definitely for you. So here's some of the things that you would receive with this particular program. So for one, I go over, and all of it, I'm teaching all of it. There's more than 30 hours of first specific content videos in video format, right? I go over 23 multiple test taking strategies to reinforce your understanding and application of the strategies. So you know how today or tonight, whatever time you're watching this from, on the presentation, I showed you a strategy, and then I showed you how to apply it. That's what I do in this program, but more, way more though. Also as well, it's very flexible, right? So you can accommodate even your busiest schedule. And the membership site is mobile friendly. So you can listen to the teachings while you're, on the go, driving, running around, doing errands. It does include a digital download workbook, right? Which is part of the program. So you download it, you work on it, you plug in and track your progress. You plug in your study times, you plug in anything that would hinder you from studying, right? Or any responsibilities you have, and you record your test scores. There's also downloadable audio lessons. I include 10 of them. Download, listen. I go over more questions, more content, more. It's mainly med surge. So it's med surge topics, pharmacology, and also how to answer more types of questions, how to answer priority questions, and more. You also get my 70 diseases NCLEX cheat sheet. You'll get the ebook version, so the digital download version, which is about 46 pages. And in here, I go over more content review. There's a pharmacology table, nursing procedures, disease processes, nursing precautions. Just about, it's so much that you need to know, but it's condensed in an easy format for you to understand and for you to review. Right? So this is about 46 pages, and you get this right away with the program. You also receive our video content library too, on top of the actual program itself. So you'll get a bonus product, which is called the NCLEX live stream video vault library. So if you ever watch any of my live videos on Facebook, especially like the ones where I really talked about and teach a topic for 30 minutes, an hour long, that's what this is. And there's almost 100 of these videos where I'm just talking about, okay, eye disorders, chest pain, disease processes, strategies, more content review for you. You also receive 20 bonus computerized assessment tests, including a pre-assessment test. So you'll have a pre-test that you take at the start of the program to evaluate where you're at and your baseline and your weaknesses. And then you'll have multiple assessments that you take throughout the program. So the assessments can vary. The pre-assessment is about 50 questions. But then the assessments can vary anywhere from 10, 15 to 25 or more questions. And they're just, once again, evaluating, did you understand what you watched in the video? So you may watch a video about cardiac, and then you'll take an assessment. You watch a video about respiratory, and then you take an assessment. And that will help to reinforce the skills that you're learning. Right? So you get about 20 of these in the program. You also, as well, in this program too, we also added our body systems crash course. So the body systems crash course is embedded in the program. Literally, it's the very first unit where I go over all of the 11 body systems. So remember how earlier I showed you the 11 body systems on the left side, and I went over the 5 things you need to know about each of them. So here, I do the work for you. And I literally give you like a crash review on all of the 11 body systems and the anatomy and physiology that you need to know for the test, right? So just go into the meat of it versus you spending months, forever learning all about anatomy and physiology. I focus on what you need to know specifically. And it also includes PowerPoint slides for all of each of the videos as well. This you'll get for 3 months access with everything I just shared so far, the videos, everything. The 70 diseases guide, obviously that's immediate download. And then the audio lessons, those are also immediate downloads too. So what that means is that essentially once you download them, you have it forever because you downloaded them. You'll gain a greater understanding of how to learn the content, for the LPN exam, even if you failed it before. You'll get a stronger content review of multiple topics covered on the exam, but here it is in an organized method. So now that takes away the stress and the headache of, okay, what do I do first? What do I do next? You're no longer going to be all over the place, but it's all organized. And then I literally tell you, okay, now here's what you should do next. Now here's how to answer this question. You get access to more than enough teaching so that way you can prepare for your exam on your time scale, right? Because I recognize that everybody has a different time schedule.
Hi, my name is Keisha, and I wanted to come on and thank Nurse Choma, who was my NCLEX prep coach. I wanted to thank her because of her, on October 28, 2017, this past Saturday, I became a licensed vocational nurse, and I passed my NCLEX. I just wanted to thank her for her encouragement and for the way she teaches her material. Just wanted to thank her because I was having some challenges, and one of my challenges was how to get past the content, understanding the content, and understanding the select all that apply. I had taken my NCLEX twice. Each time I got 205 questions, and each time I failed. Each time I thought I was ready because I had friends and instructors who told me, do questions. That's all you got to do. Do questions and look at the rationales. And that's what I did. And both times I really thought I was ready. But when I discovered Nurse Choma, I was at a loss. I didn't understand. I was trying to figure out what was it I was missing, because each time I got the 205 questions and each time I got my results, it said near passing in all categories. So I'm trying to understand what was it that I was missing. And when I discovered Nurse Choma, she helped me to understand the content, understand exactly what I was missing in the content. She helped me in simple forms understand what it was I needed to do, which was critically think, change my way of thinking, think like a nurse. What would the nurse do? I took her Select All That Apply seminar, and it was the best thing that I could ever do. I watched her videos every day. I sat and waited for her to come on, and her examples that she used were simple, they were understandable, unlike anything else that I had tried to do with other resources, other books. It didn't click until I found Nurse Choma, and I just want to thank her for the way that she teaches. Even though I took my NCLEX this last time and I still got 205 questions, I understood what I was doing and I passed at 205. So anyone who's out there who's going to, and you think you cannot do it, listen to Nurse Choma. She can help you pass NCLEX. Thank you, Nurse Choma. From Keisha, licensed vocational nurse.